for a routine checkup. You've had some chronic pain and fatigue and just needed to go in. When the tests come back, you have an inoperable brain tumor. You are being put on about 50 milligrams of morphine patches every single day. Now fast forward about a month. You have lost 20 pounds because the morphine makes you very sick and ill along with chemotherapy. Your skin is red from radiation. You're weak, cannot move or do anything. Fortunately, we live in Colorado or Washington, where you are able to get medicinal marijuana. However, when you go to get it, the federal government raids it, arrests you along with many other cancer patients and glaucoma patients, and arrests the proprietors of this medicinal marijuana plant. This happens occasionally because federal government laws are not the same as state. And today I'm going to tell you a little bit about marijuana, a brief history of it. I'm going to tell you why I support medicinal marijuana. I'm going to tell you about some other people who have been fired from their jobs, cancer patients, etc. I'm going to tell you about state laws in Oklahoma. I'm going to tell you about federal laws as well. So first, what is marijuana? It's a naturally occurring plant, contains chemical abbreviated THC. It binds to receptors in your brain and the hypothalamus that controls appetite, and the hippocampus that controls memory and learning abilities, and the brainstem that controls the vomiting reflex, and the cerebellum that controls most of the motor coordination in our bodies. So where did it come from and how did it get here in the United States? It was first documented as being used as a psychoactive recreational drug around 2700 BC in Asia. The Spaniards actually came over with it. It was not natural to the Americas in about 1508 AD. And now in Mexico it thrives all over the place. The English colonists, they kept it in Virginia, and it grew alongside tobacco for use as fiber and ropes, or you guys may know it as hemp. In the 1970s, the Controlled Substance Act, abbreviated CSA, was passed, which made marijuana a Schedule I drug. A Schedule I drug also includes drugs like heroin and cocaine. Alright, so now you know what marijuana is and how it got here. And I'm going to talk to you guys about some Oklahoma marijuana laws. I found this information on findlaw.com because setting through pages from Oklahoma law is just not as exciting. Under Title 63, possession under 1.5 ounces is considered a misdemeanor, which you can get 1 year imprisonment or up to a $10,000 fine. Over that, it just said about twice folds. It can go up, it really all depends on the jury that you have. For sale, it is a felony offense, 2 to 10 years imprisonment, up to $5,000 fine. I have known from different court cases that it can go up tremendously. And then trafficking is having 25 to 1,000 pounds of marijuana, and that would be a fine of $25,000 to $100,000, as well as imprisonment really depends on jury and judge. So they can imprison you, it doesn't really say, it's a loose law there. Over 1,000 pounds to 100,000 to 500,000 plus prison time depending on the jury and judge and how good of lawyers that you have. On Marijuana Policy Project in Oklahoma, I found that our Senator Johnson is trying to pass a Senate Bill 710, which would make medical patients able to possess 8 ounces of marijuana or 12 plants. They would also be able to legally obtain it from dispensaries here. Senate Bill 914 is also pending right now. It would reduce jail time for possession from 1 year to 10 days on that possession we went over in Title 63, and reduce the fine from $10,000 to $200,000. And I would also like to talk to you about federal law now. According to whitehouse.gov, marijuana is a Schedule I drug because of the following circumstances, because it's so easy to abuse. The Health and Human Services and the FDA made a petition and gave it to the DEA. The petition was made off medical and scientific analysis of marijuana. The DEA has refused that. So even though state laws may change and we could get a medical marijuana dispensary here, that doesn't mean that the federal government can just not come in and raid the entire thing and arrest whoever they want to. They can still legally do that from federal law. So now I would like to share with you why I support medicinal marijuana and really would like Senate Bill 710 and 914 to pass. Because it could be used as an everyday painkiller from headaches to everything else without any harmful fillers. The fillers in Tylenol over time can actually affect your liver. I got that from herbalmission.org. It decreases force that glaucoma puts on the optic nerve. It's a natural antiemetic, which means that it makes you less sick. And it's really useful in cancer patients that are undergoing chemo or anyone suffering from HIV or AIDS wasting diseases. I found an article from Mint Press News by Katie Ruck that follows a former Walmart employee, Joseph Cassius. Joseph Cassius was an inventory control manager at a Michigan Walmart. He had an inoperable brain tumor and was given medicinal marijuana to help with his everyday pain. At work, he got a drug test and they found marijuana in his system. They immediately terminated his position even though he had worked there for almost 2 decades. And when he showed him his Michigan medicinal marijuana license, they said it did not matter that he was a patient and he had to take these drugs. It does not comply with their safety policy. And so he was legally terminated. And this can happen to any patient and any person that uses this. And I found a rebuttal to marijuana, medicinal marijuana, in Stop the War on Drugs by David Gordon. Apparently, it doesn't really have to do with what is right or wrong. It's just our treaty policy with the UN. Politicians would have to rewrite and to completely revise our international policies, apparently, to even legalize marijuana. And that is why it continues to happen. But today, I would like to leave you with, what do you think about it? Are you going to see these bills through, Senate Bill 710 and 914, or do you disagree with marijuana? And how do you disagree with it? Just because we have treaty laws or some other something? But